will be opening a poll. It's something that we usually do at the beginning of all our sessions, just to get to know you a little bit better. So you should be seeing the questions appearing on your screen now, and we'll give you 1 or 2 minutes to answer the questions that you think. As we can see, more and more answers are coming in, so I'll just start reading the preliminary results. Almost half of the participants here are from Eastern Africa. Actually, in fact, exactly 50% of our participants are from Eastern Africa, so welcome. We're very happy to have you here. In the question, which stakeholder group best describes your role? The majority of you, so I would say 25%, are from industry, followed by 19% of you from development partners or implementing organizations, 12% from UN agencies, and 12% from ministries of health. Which focus group do you belong to? 41% of you are from public health or health system strengthening, 39% from policy, strategy, governance, 39% from research and analytics, and 32% from supply chain, logistics, and operation. When it comes to the level of professional experience in supply chain or health systems that we have, over 30% of you have more than 15 years of experience, a quarter between 11 and 15 years, and 32% are currently students. Finally, 21% have between 6 and 10 years of experience. When it comes to confidence levels regarding the usage of data for decision-making, 46% of you are somewhat confident, 32% of you are very confident, so that's quite nice to see. 60% of you describe yourself as having limited confidence, and 4% of you hopefully are going to benefit very much from this webinar. For those of you who have replied, not confident. What are the biggest challenges you face in using data effectively? 60% of you believe that it's a limited access to quality data, followed by limited skills or training, which is 46%, and also 46% have replied organizational or system level barriers. 30% say data not integrated into decision processes. And for the final question, what is your primary objective for attending this webinar? There's a pretty clear answer, which is 80% understanding how data can improve decision-making in healthcare supply chains, followed by learning practical tools and frameworks for operations, and exploring capacity building and institutional approaches. So I'll be ending the poll now. Thank you very much for having shared your answers with us. And on that note, I have the great pleasure of introducing our first speaker, Mr. Philip Oguche, who's a manager in the warehouse operations and supply management at the Medical Research Council Unit at the London School of Hygiene and Tropical Medicine in Nigeria. He has a deep expertise in pharmaceuticals and laboratory products, and with a background in pharmacy, an MBA and advanced certification in supply chain and logistics, he brings a strong analytical and systems-driven approach to supply chain leadership. Well, you can really see all of his incredible achievements on the screen, so I'm not going to be reading those out. But Philip, we're here to hear your insights on the question of data-driven decision-making frameworks and how those can be used to strengthen healthcare supply chains and improve operational efficiency. So, Philip, over to you.
Okay, thank you very much, Daniel, for that introduction. Yes, and then good morning, good afternoon, good evening to all of you, irrespective of your time zone. It's just a quick presentation we are going to be doing today on decision-making frameworks for operational leaders. So most times when we hear about decision-making frameworks and then with the rise in AI, most people look at situation, most people have this impression that AI is coming to take over people's job, but that is not what it's supposed to be. The whole idea of having AI is to help you make your job much, much better and easier. And then in addition to that, the idea of having a decision-making framework is to also help you have a structured way of approaching your problems so that for every problem you solve, you can also learn from it. And when you encounter such problem in the future, based on your past experience, you can easily profile a solution for that problem. So next slide, please. Yes. So the presentation is divided into 4 sections. For the first section, we are looking at the foundation of decision making in healthcare and then supply chain. For the second part, we'll be looking at data-driven decision frameworks and then models. How do you make your decision? Based on what framework do you use? And then for the third part, we'll be looking at decision maturity and then organizational capability. And then for the last part, we now look at how the integrated operations and then control system help you to be able to make better decisions based on the established framework in your organization. Next slide, please. Yes. So it is very nice to have experience, right? But experience alone is not sufficient to help you get the job done, especially in modern supply chain, given that you have a lot of data flying around. For you to be able to make these decisions properly, intuition alone or experience alone cannot really help you to make decisions accurately. That's where you now need data. And then for you to be able to use data effectively, you need to have a good foundation on how you use this data. Next slide, please. So now, why is it important to have data that is structured? Without a data that is, if your data is not structured, you can't use it, right? Because it will not make any meaning. From the pool that we just had now, you can see that a lot of people are complaining about the quality of data. This implies that the data that they are seeing is not structured properly. And then if you have your data structured properly, your framework will now work actively for you. It will help you to reduce bias. And then if there are constraints upstream and downstream, you'll be able to see such constraint and then work on them. And then if you have a very good structured data, that is when you can now start benefiting from the effect of having data in the first place. If your data is not structured to the point where you can't utilize it, we all know that having data that is of bad quality is as good as you not having data. Next slide, please. Yeah. So what are the challenges that we are facing in modern supply chain? Supply chain volatility, we can all see from how volatile, especially in the last, let's say 5 years, a lot of changes have happened in our supply chain in which we never believed could happen. COVID came and it changed everything for us. We all started thinking in a different way. And then with recent cuts in funding across the board, especially in places that are let's say LMIC, that's low and middle income countries that heavily depend on donor funding. We saw the cut in donor funding, how it is affecting all of us and how we are all still struggling about it. So for us to make these decisions appropriately, we need to look at the supply chain volatility, the rising cost, data fragmentation, and then time and team alignment is very, very critical. We have seen instances where maybe if the data is coming from a specific team, we cannot really work, we can't trust it. Why? Because historically, working with such data from such team always lands us in trouble. That is why having a structured way of working where all the team approaches problem from a unified perspective creates outputs that help other people that forms input to other teams, and then they also use it to make a good decision and the entire organization benefits from it. Next slide, please. Yeah, so what is the role of leadership? Leadership plays a very good role in the sense that leadership sets the foundation and sets the tone for the organization. If you have a leadership that does not like using data, then it means the entire organization may likely not be interested in data. But if you have a leadership that believes in evidence-driven approach and then prioritizes data integrity and analytical rigor over habit and intuition, then it means that organization is going to be heavily driven by data. And then this same leadership has to enforce a critical thinking nature. Instead of you just accepting things, this is how we have been doing it in the past. Do we still have the same scenario happening in the present? No. Therefore, you should be able to think through it and then think of a better way to do things instead of depending on what you have done in the past. And then we also need to look at where you balance data and experience. In as much as experience is very important, you still need data to also make decisions. And even if you have data, you still need experience to be able to interpret that data appropriately. So you need both experience and then data. Having data alone is not sufficient, and then having experience alone is not sufficient. So both of them need to be blended together. For example, let's say you see an annual data, and then you maybe see an annual data of malaria infection, and then you now trend it and you now see that, oh, malaria comes at specific season, right? You can see that from your data. But if it happens that way, what do you do? There are other things that your data cannot really tell you, which you can also get from experience, or maybe there are due to limitations. Your data cannot really interpret the data, interpret what it is saying clearly. That is where you now need experience to come in, now help you explain the data appropriately. Next, please. Yeah, so now we now move to the second slide, which is the data-driven decision frameworks and then the various models that we have. Next slide, please. Yeah, so normally for you to be able to make decision, there is a data to decision pipeline, which we'll just explore briefly due to limitation of time and time constraint. We'll not go into details of all of it. But the first step of you even having data is for you to gather your data. And then for healthcare supply chain, majority of our healthcare supply chains use ERP systems, or you have one or two forms of records, either paper-based or electronic records where you have data repository. So the first step is for you to collect this data. When you collect this data, in what format is it in? You have structured data and then you have unstructured data. So for the structured data, those are the ones that you can easily input into the database that is very popular. That's the SQL format database and the rest. But for the unstructured data, that is the one that is not much popular, but people have started moving into working with unstructured data, especially let's say for clinical records, maybe where you are trying to extract information from patient's record and the rest, where a doctor writes a note about a patient's history, but you still need to get information from it because most of those records are really usually in unstructured format. So you should be able to collect such data and then still analyze them. After collecting them, the next step is for you to process the data processing and then getting insight from this data. After getting this data, what do you do with it? You should be able to make decision with it, right? How do you make this decision? Evaluate it, compare it with alternatives. These are the alternatives I have. Which one is better for me? How do I balance this? Let's say maybe you're trying to evaluate suppliers. You're not evaluating supplier based on what? Just the cost, the risks, and then other things you think are important to you. Instead of you just relying on just one element alone, let's say cost, to evaluate a supplier. And then after making your decision, the next step is execution, right? So this execution helps you to make improvement in your process. Okay, maybe based on your decision, you realize this is the decision I need to make. Do I have the enabling environment to make the decision, yes or no? It now helps you to now start translating it. For example, let's say after making your decision, what kind of inventory policy do I need to have in my organization? What policy changes do I need to implement based on the decision I've seen, which were informed by the data we have collected, and then you now monitor the outcome and then see where you need to make changes, and then you redo the process all over again. Next slide, please. So this is just an example of it. Because of time frame, we'll just only pick one approach of making decision, and then let's see how it looks like. So like in this case now, maybe we are trying to evaluate suppliers. So we are using this multi-decision criteria approach. If you can see, as you can see on your screen, we have three options: option A, option B, option C. And then what element are we looking at? We're looking at cost, quality, risk, and then time. So based on the weight we have apportioned to each of these suppliers, based on the information we have collected from this supplier, you can see that making decisions alone on cost is not going to be helpful to us. We need to have a balanced decision. And if you look at our scale, from these three options that we have, it looks like going to option B has better outcome for us, because we are not looking at just low cost alone. We are looking at the quality, right? The quality, what is the risks associated with the supplier? And then even if what are the risks associated with the supplier, what time frame can the supplier deliver this item to us? We can decide to go with low cost, and then we get the item maybe like 2 years down the line, then it means that item was never available when we really need them. So looking at each of them, you now apportion your appropriate weight, and then you make your decision and taking into consideration the trade-off that are bound in that decision-making process. Next step. Next slide, please. Yeah, so the operational decision loop is this. You first of all, you sense, you analyze, and then you decide, and then you now act, and then you learn from what you have analyzed. And then if there are things that you need to make improvement from your learning, you are implement them again. You now start the process all over again. You sense, decide, act, and then you learn again. Next slide, please. Yeah, so we are moving down to the decision maturity and the organizational capability. Next slide, please. So there are different stages organizations find themselves with respect to making decisions. A lot of organizations are still in the reactive phase. In this reactive phase, you have a lot of firefighting happening here, where, oh, you just wake up, we have this emergency, we have that emergency, people are firefighting, running around, trying to figure out what is happening, right? And then from this, they can now progress to the next stage, which is visible, where you have the dashboard informing you this is the outcome of it, of your decision. This is where we are right now. And unfortunately, these dashboards are once your dashboard becomes red, and it means the problem has been on for a while before you start seeing the red there. So still having dashboard is not enough for you to just to react, because majority of our indicators are usually lagging indicators. The action has already happened. We are just collecting data to monitor what has happened. It is very rare to see leading indicators that help you make predictions. When you now start making those leading indications, that is when you now come to the predictive part, right? So organizations that are the predictive part, they hardly firefight, right? Why? Because they can sense and then they can make predictions to say, okay, in the next 3 months, we are going to run out of stock. If we are going to run out of stock, then what do we need to do right now to prevent this from happening in the next 3 months? Or let's say we have this issue, okay, just like the ongoing crisis in the Middle East, what is the impact of the crisis on us, right? Some organizations will not feel the impact right now. Some may likely feel it in the next 2-3 months. So what plans do you have till that time when you anticipate that you are going to feel this? So organizations that are at the predictive stage hardly firefight, except you just have 1 or 2 emergencies that come up, right? Instead of you having emergencies always, and then people are tired, people are fatigued, and then they can't concentrate on their work. And then organizations that have now moved to the prescriptive phase, that is where you have people that have automated a lot of things about their supply chain, where they have better controls over it, they can now decide their own outcome. And now say, okay, based on so and so, let's say, for example, if you have an item that is strategic to you, how do you manage such items? Do you have strategic relations? Do you form strategic relationship with suppliers so that for every time you need this item, based on your agreement with these suppliers, you can always get this item, right? So in this at this level now, you are now prescribing solutions ahead to mitigate problem, or to even prevent, or to even eliminate some of those challenges, right? Next slide, please. Yes, so organizational readiness for data. How do you get your organization ready? It is not just by having data that is sufficient, right? You need to build the organization. to become what data literate. This data literacy, it has to be across team, right? You cannot be collecting data and then the other team cannot interpret that data, right? So all the teams should be able to should be what data literate. They should be able to interpret dashboards, statistics, and then the predictive indicator. That way, when people start seeing certain numbers on their dashboard, they know the implication and then they should be able to act or escalate it before it happens. And then the process role and alignment. At this point, you now need to standardize your roles and alignment and then reduce as much as possible conflict in roles, which tend to create organizational paralysis in most instances. Because at this one here, you are thinking this team is working on this, you are thinking that team is working on this, but nobody is working on it. It's more like saying everybody's business is nobody's business. So you need to align your processes properly and then standardize your workflow so as to ensure ownership and then clarity. And then technology. So if you have all of these things, your technology should be able to communicate with each other. We have seen a lot of instances where maybe electronic patients record, right, exist in a different system from your ERP, and you need to make decisions using both of them. How do you connect the both of them to make decisions? Or maybe you have people still using paper record that they have to physically write on. How do you extract information from this and then make the appropriate decisions? So all the technology you are implementing should be able to talk to each other. We have instances where people use APIs as application program interface to connect two independent systems so that the data from one system can actually feed into the data from other system. And then on the long run, you just have a single dashboard that collects information from all your system, irrespective of the vendor. Right, and then data governance is also something that is very important. You need to institute data governance, right? Ensure that everybody adopts it. And then leadership is also at the forefront driving this. And that is the only way it can work. And then security, while you are trying to digitize your supply chain, you need to also take into consideration the security of your supply chain, because we are moving to the era of where we are going to be seeing a lot of cyber warfare. And what you just need, your competitor just need to do is to just, let's say, paralyze your system, and then you realize that you can practically do nothing. You have to either change your entire system, or you have to go and pay ransom or whatever. We have seen where people actually kidnap other organization systems, and then they have to pay ransom to get their system released so that they can work. Why? Because they have digitized their organization to the point where without these systems, they can't work again. So while you are building these systems, it is very important that you also ensure that the systems have appropriate security. Next slide. Yes, so the advanced predictive analytics that we talked about earlier helps you to do what? Improves your forecast accuracy. You should be able to model, right? Optimize your operation. What we see in most instances is people doing selective optimization. Maybe you have processes that cuts across team, you optimize for only one team, you leave out one team. If you don't optimize across the entire operation, the selective optimization is still going to affect you. It's still going to be as if you have not really done anything. And then with your proactive risk mitigation, you should be able to make predictions based on current situation to create early warning flags that will help you to start making adjustments in your operation. And then with continuous improvement, you always learn from your action. Since you have everything on record, you can look back to say, okay, this is the decision I made at this particular point in time, and then this is the outcome of this decision. And then based on that, what should I do if I find myself in such situation in the future? I believe if COVID should happen again, we'll all look at COVID differently from the way we saw it back then in the 2019, 2020. Next slide, please. Yeah, so supply chain risks and analytics. So while you are trying to digitize your supply chain, the risks is very, very important. As I mentioned earlier, security, right, is one of the top things that you need to look at. And then while you're also doing that, your suppliers, what are the risks your suppliers may likely be subjected to? If you have an item that is very strategic to your organization, right, how do you get your suppliers? how do you know when your suppliers are going to default in it, right? So with the right analytical method, you should be able to take into consideration this your landscape and then the various risks associated with it. Then early detection is also one of the benefits you are going to get. And then based on all of this, your decision will now be making the right impact, and then you will be having an efficient supply chain. Next slide, please. Yeah. So this is where you can move to the next slide. This is the last part of the presentation, where we are now looking at how to connect all of these things that we have done, the systems that we have done, and then all the benefits we hope to achieve from it. Next slide. Yeah, so what is becoming the norm now is people having healthcare control towers. So this control tower is basically where you sit. You have all your data. You can look through to see, okay, what is happening at the point of procurement, what is happening at the point of sourcing, what is happening at the warehouse, what is happening at the clinic, most importantly. That way, you just sit in a control room, you can monitor everything, and then you make decisions appropriately. Next slide, please. Yeah. So decision execution and continuous improvement. While you, as I mentioned earlier, that improvement is a continuous process. While you are trying to improve and then make changes in your supply chain, there are new technologies that will always keep coming, and these technologies will be critical. And then after a point, it turns your current technology into a legacy, your current system into a legacy system, and then you need to adapt. So learning and then improving continuously will help your organization better align. And then the cross-functional coordination, your leaders, everybody needs to align. Why? Because they have the same view. You can look at it from the control tower perspective, and then we all understand why we need to chart a particular course, and then we don't need to go and be lobbying and then trying to get everybody's buy-in. All right. Next slide, please. Yeah, so in summary, structured data decision making helps the healthcare, right? And as we know, without product, the program cannot really happen. So the supply chain that are making this healthcare system to work needs to be very efficient. And one of the way they can become very efficient is through making decisions using data and then using the right framework to make decisions instead of using just a single criteria in decision making. So we looked at the decision pipeline, how we can use predictive analytics, risk assessment, and then control towers to enable our organization make the right decision. There are different frameworks, there are different ISO standards and guidance on how to do risk assessment, which is beyond the scope of this presentation. So we did not do much on that part. So I think we are now at the end of our presentation. Thank you.
Well, thank you very much, Mr. Phillip, for these extremely insightful perspectives on how data can drive effective decision making at the operational, but also at the strategic levels. I'm sure that you'll be receiving lots of questions at the end. Well, the conclusion of Mr. Phillip's talk brings us to a very important question, which is how do we ensure that these capabilities are not isolated, but also systemically developed and sustained across systems? So to explore this question, we will shift from practice to a more systemic point of view. And this will be provided by our next speaker, who is Rebecca Albin from Village Reach. Rebecca, it's great to have you with us. Thank you. And we look forward to hearing your insights on how academic institutions and partnerships play a critical role in building strong, sustainable supply chain capacity through education and training. So over to you, Rebecca.
Thank you so much for the introduction, and to Dr. Guche for the first presentation. I'd like to shift a little bit away from the complexities of data and decision making, but I think that tees this up really well so we can talk about the enabling factors that are needed, so that, as Dr. Guche noted, our healthcare workforce needs to be data literate, both at the high level to be making decisions looking down from that control tower, but also at the most basic level, thinking about a healthcare worker looking at a stock card and needing to decide whether they need to order supplies or not. So data is important at all of these levels. And what I'd like to focus on today is how we bake those decision-making skills into our health systems. Next slide. And in my title, you notice I've used the word institutionalizing, so that we can talk not just about traditional training, but actually about making sure that this is part and parcel of a country-led institutional capacity building effort. So if you all will indulge me, I'd like to start off with sort of a mental exercise by looking at this visual together. I know there's a lot here, but if we can put ourselves in the minds of people that are in low and middle income countries that are in need of supply chain education at different levels. So what you see on the visual are two what I've called supply chain educational and career pathways. And in the red, you see the various challenges that these people may face toward achieving that ultimate goal of becoming a skilled supply chain professional. So I'll first walk us through pathway A, which is the pathway of somebody who wants a formal supply chain education. They want to become a logistician or work at a high level in the supply chain, like an analyst, let's say. So starting off at the left, if you're a student considering your options, most people, according to our research, have pretty limited awareness of supply chain as a profession. Particularly women and youth do not consider it or look into it as a profession when they're choosing their careers. There's just a lack of awareness to start with. And then as you progress and get older, we see that people are met with the other barrier of there being just few degree programs, particularly degree programs that focus on public sector and on healthcare. A lot of degree programs may be private sector oriented and not really have all the relevant skills that match with what we're looking for public health supply chain management. And I don't have time to go through this whole thing, so I'm going to move now down to pathway B, which touches on, I think is the more common pathway actually, which focuses on healthcare professionals such as nurses, pharmacists, healthcare technicians, who choose a healthcare profession, but will end up having to do supply chain tasks in their job. So that is a skill that they need. So what we find is that many people go through that education, they get their certification, they get trained, let's say, as a nurse. But many of these programs actually lack supply chain educational courses. People graduate from these programs without having basic introduction to supply chain principles, how to look at data, how to read a stock card, how to make decisions based on the information that they have. So it's a really important challenge, and that one that I'm going to touch on a lot today is that there is a mismatch in a lot of the educational programs that healthcare workers are in. They're mismatched with what the actual skills needs are for somebody that will be doing supply chain activities, and they're missing those skills building opportunities in their academic curriculum. So that's something I'll be delving into today. Next slide, please. So we know there's a lot of great work being done by Empower, by lots of partners here on this webinar, in fact, to address a lot of those challenges that you saw on the previous slide. So the first one I've noted is that there's lots of supply chain training programs, there's professional certifications, there's online, there's in-person training opportunities, and I think many of us are probably familiar with those. So that is actually not what I'm going to talk about today. There's also lots of opportunities for industry collaboration, partnering with the private sector and other NGOs to give people supply chain experience. There's Step 2.0 program, which some of you may be familiar with, which has that industry collaboration actually built into it. So again, this is also not what I'm going to talk about. What I will focus on today is, if you could advance the slide, are opportunities through academic programming, because that's something that I think is less talked about, it's less known, but I think it's also an important way that we can solve that challenge that I mentioned earlier of there being sort of a mismatch between the pre-service education that healthcare workers are receiving and the actual skills needs that are on the ground when they enter the workforce. So what does this look like? In one way to start, and this is what we've done as Village Reach and looking at academic programs, is you look at what is existing in the landscape, what is happening on the ground in a particular country, and determine what improvements can or need to be made to incorporate supply chain content at different levels. So questions you can ask yourself and investigate are, are nurses graduating from their nursing programs without learning how to manage products, without learning how to fill in the forms they will need to, without learning these data decision-making skills that we've been hearing about. Same question for pharmacists. Are they equipped with those skills, or are they just learning them on the job and getting by, learning from their colleagues? Are there systems that people need to be using on the job, like an LMIS, that they need to be trained on, and they enter the workforce and then all of a sudden they need to attend another training after having gone to 3 years of school? Are there either easy opportunities to integrate those skills into the pre-service training? Are there bachelor's programs? Are there master's programs that are oriented toward public health supply chain education? So those are some questions to answer when you're looking at these academic programs and at the opportunities to align those skills needs. Next slide, please. Oh, so this is the one that's the build. You may need to advance the slide. Thank you. So what are the things we can actually do? At the top of this slide, I've highlighted sort of 3 opportunities. One is to integrate supply chain content into an existing program. So an existing pharmacy program, an existing nursing program could be adapted and add a supply chain module to it. There are existing degree programs. So number 2 is to revise an existing degree program. We've seen some that are very complete, but they're not current. They're not up to date with the supply chain systems, with the tools, particularly with digital tools that are being used in the country. So there are opportunities to revise and update. And then there are third is that there are opportunities to actually create new programs. And Village Reach has been involved in these different, all 3 of those activities. Going into the benefits, the main benefit that I see is that health workers, as a result of these programs, would enter the workforce with the supply chain skills that they need. That is the goal, to reduce the need for top-up trainings, reduce the need for other in-service activities. There are multiple entry points. I mentioned the different types of schools. There's technical schools, bachelor's, master's degrees, so lots of opportunities. In our experience, we've seen institutional buy-in to be quite high. The academic programs themselves have an interest in improving their service offerings, improving their capacity to meet the needs of their students. So generally, the collaboration for us has been good, and there are other partnerships globally with other implementers and foundations like the Kuna Foundation, who are available to help with curriculum development and leverage existing curriculum. Key considerations when doing these types of activities, the first is that it's not quick. It's time-consuming work to build partnerships, align on needs, to create curricula, to validate it, and go through all of the hoops to do that can take time. It may not fit into a quick and easy grant that you get where you need to show quick outcomes after 6 months or a year. You need to have a longer time frame and view on this. And another consideration for if you're adding new courses would be market alignment. So making sure that you don't create a course and create a cadre of people with a skill that then they can't get employed for. So it's something that you would want to look at if you're doing that third option. But the opportunities here are many. So I've listed a few. One, again, is reducing the need to have in-person training over and over again for different skills, would reduce costs over time. There's also an opportunity to involve Ministry of Health when you're developing or revising a curriculum so that it ensures that their needs are met. If they have certain jobs that they haven't been able to fill, if they have a new, like I'm saying, electronic system that they want people to learn, that can be inserted into a pre-service curriculum rather than having to train people on the job. So getting ministry involved is a really important benefit and opportunity. There's also a great opportunity to scale and impact many people through these opportunities, and I'll give an example in a moment. And there's also opportunities to engage youth and women in these programs. So as we design them and talk about marketing them, we know that supply chain doesn't do a great job of attracting women and youth into the industry. So I think there are opportunities to do that too. Next slide, please. So I wanted to just show a few photos and talk about Village Reach's work experience in this space over the last few years. So this first photo is in Malawi of some graduates from our pharmacy assistant program. And over the years, institution and spread into multiple. So that's been something that has scaled nationally, and now we have thousands of graduates who have benefited from that program. So I wanted to just show the opportunity for scale. And I should mention in some of these programs, we've had the pleasure of partnering with Empower School of Health, the Kuna Foundation, and their sub-organization called Learn Logistics, and many academic institutions across Mozambique, Malawi, and TRC. The second photo there is us as partners, so those partners that I just mentioned, and I'm showing that because a lot of this work does take place behind the scenes, aligning with the partners, developing content, making sure the ministry's gotten their say in all of the different content. So there's a lot of consultation with small groups of partners. The third photo is a training of trainers that we did in Mozambique, working with an organization that wanted to start a new degree program, but the professors didn't have supply chain skills at this point. So we had to upskill the professors themselves to make sure they were ready to actually deliver the course. So just wanted to share a little bit of what that looks like in practice. And then the last image there is of our healthcare logistics bachelor's degree that we created in Mozambique. So the outputs of this can be very significant. We created the first supply chain degree, bachelor's degree in Mozambique, and that was in partnership with the ministry and something that they really wanted to see, and now are very pleased to know that they will be getting skilled healthcare logisticians in their pipeline of workforce to help them. Next slide, please. Oh, are we missing one? Oh, okay. So in conclusion, I wanted to highlight a course that has been launched by Empower School of Health with consultation from Village Reach, USAID, and a number of other partners, which is very relevant to the topic of this webinar. It's about data management, and it's a postgraduate diploma that is available through Empower. I think you can find it on their website, and it's a 12-month program that can really guide in a lot of the skills building that I've been talking about today. So thank you.
Well, thank you very much, Rebecca, for this. It was really inspiring and insightful talk on the importance of strengthening institutional capacities. So dear participants, now that we've explored how decisions are made and how systems are built, we move on to the next phase of this journey, which is discovering the people who drive these systems and these decisions. So the key question that we're facing now is, who are the professionals making these decisions and how do we prepare them in an effective manner? So we're going to be turning to the human element of this transformation. So for that, I'm delighted to introduce Dr. Shamli Thakur, a great friend of UNITAR and the UN. So Dr. Thakur will be guiding us through the evolving landscapes of skills and competencies and career pathways in data-driven healthcare and supply chain management. So over to you, Dr. Thakur.
Thank you so much, Daniel. Thank you so much to our esteemed speaker, Mr. Philip and Ms. Rebecca. Greetings from India. Thank you to all attendees for joining this webinar. So let's have a look at the table of contents. So I'll be covering evolving workforce needs in data-driven healthcare, different career pathways and professional growth opportunities, and then the core competencies for future-ready professionals. Next slide, please. So if I look into this room, or I would say this virtual room, we have people coming from different backgrounds. Like some of you are clinicians, healthcare professionals, others must be working in public health domains. Some of you are from supply chain and logistics. Many of you are coming from data, IT, or digital systems. We also have program managers, recent graduates, and I believe even entrepreneurs building solutions in their space. So at first glance, it might feel like, we all are coming from completely different worlds. But here's the important point. What connects all of these roles today is data. So whether you're managing patients, planning supply chain and logistics, analyzing systems, or designing programs, you're highly expected to interpret data, make decisions, and act quickly based on that information. And that's exactly what this session is about. So it's about the skills, the competencies that sit at the intersection of healthcare, supply chain, and data systems. So why are these become essential? So regardless of where you started your career, and no matter which box you see yourself in here, this conversation is actually relevant for all of you. Next slide, please. Okay, so let me start connecting with what Ms. Rebecca just shared. So across countries, we are seeing real progress. So there are strong education systems, training programs are there, improving better institutional capacity. But when we look at the outcomes, so, when it comes to stock availability, service efficiency, or even patient access, we still see a wide variation. So why is that gap? Because some systems, systems are there always to make decisions, but it is not the complete decision taken by the systems. It is the people, the individual using the systems. They are the ones who impact the final outcome. Next slide, please. So why data skills are no longer optional? So if I talk about the integration of healthcare and supply chain, so in healthcare, supply chain is not separate from care. It's an enabler of care. So supply chain enables care. So if a medicine is not available, it's not just a logistic issue. It directly affects the treatment. It directly delays the treatment. It can cause inequitable access, stock imbalances. So increasingly, these decisions should be made faster across multiple systems. There has to be ensurety of interoperability, the seamless integration of data across the system with completeness in the information. So now the question is no longer that do we have the data? We have ample amount of data. But the real question is, can we use it effectively and timely? So because of this change in demand, change in need, you have to understand that data is not just a support function, it is very core to the healthcare delivery. So with the changing dynamics in terms of requirements, demands, the roles are also evolving. Next slide, please. So now let's talk about how traditional things were. Traditionally, healthcare focused on just the treatment part, and supply chain used to just focus on the logistics and the delivery aspect. But now both are expected, both domains, supply chain and healthcare, they're expected to have interpretation of data, anticipation of needs, optimization of decisions. So what we are seeing now is a new wave of professional emergence. So we need people who understand healthcare, supply chain, and data. So now let's understand what exactly the professionals need to know, the different career pathways. Okay. So next slide, please. Let's understand the overview of career pathways. So it's very exciting to understand this, that it's no longer a linear, career curve. So people are moving across the domains of healthcare and supply chain. So there are multiple entry points. From healthcare, you can say nurses, pharmacists, and from logistics and operations, we have the ones professionals having logistic roles, data and analytics roles. So there is an increased demand for data-enabled healthcare and supply chain professionals. And career progression is directly linked to the ones who are equipped with digital skills, equipped with data-driven decision-making skills. So they are the ones who are moving faster, the ones who are taking on more responsibility in making data-driven decisions and influencing decision at the higher level. So as you can see, the growth ladder, it goes higher for the ones who are upskilling themselves as per the data skill sets and the competencies. So now let's understand the different job areas in this domain. Okay. So what do you notice in this, table? So there are a set of roles, and if you have a look, you will find that the biggest shift in each of these, domains and the roles is that they are including data, they are including the digital aspect, the digital tools, or artificial intelligence. So when it comes to healthcare delivery, now healthcare is no longer just clinical, it is now digital. So roles where data support is there, telehealth, AI-assisted care. Coming to supply chain and logistics, like how are we avoiding stockouts today? So by data-driven decision-making, forecasting, and so the roles focusing on analytics, tracking, and digital systems. Coming to data and analytics, the engine of decision-making. So roles are moving from analysis to artificial intelligence and leadership and digital health systems. So one should have the tools like, the understanding, the knowledge of tools like District Health Information System, DHIS2, Logistics Management Information System, LMIS, because without these systems, there is no data. And for pharmaceutical management, there is a shift from the manual processes to data-driven quality and supply monitoring. So lastly, it is who is actually using all of these data across the domains, the leaders, the program managers. So these rules combine health, supply chain, and data for strategy. So no matter what your field is, adding data and digital skill is no longer optional, it is essential. So now coming to the employment opportunities, you will find this slide very helpful. So where do you see yourself? Like if you are coming from an entry level, career, mid-level career or senior level. So at entry level, you have supporting role plus digital tools exposure. At mid-level, you will find yourself into analysis using AI and system specific roles. And at senior level, you have to be very strategically making data-driven decisions and attaining leadership, strategy, and transformational roles. So you can find, employers across ministries of health, NGOs, WHO, UNICEF, and, you have good number of platforms, job search platforms like DevX, UN Jobs, LinkedIn, Impact Pool. So growth comes from adding data-driven skills into your, scaling strategy. Next slide. So I will just, focus on like what are the core competencies for future workforce. So a future ready professional is not just defined by one skill. They have to be combining healthcare understanding, supply chain knowledge, digital systems and data, but most importantly, can they act on that information? Because without action, data has no value. So impact happens at the intersection of data, healthcare, and supply chain. Next slide, please. So now the 4-step action pathway. Now let's, make this practical. What you should be doing next. So like once you're done with this webinar, you collect your certificates, what you need to be, doing. So to optimize yourself, you have to build a strong profile, your strong LinkedIn profile or your strong resume. And then you need to upskill yourself. You have to gain skills in, different domains, including supply chain, data management, digital health. You have to be registering yourself on multiple job platforms across this, industry sectors. And very valuable, join networking, join professional academic forums, attend different webinars, attend different conferences like you're doing this, you're attending this webinar. Next slide, please. So Now let's talk about how are you going to upskill yourself. So these are the set of courses that are developed in conjunction with UNITAR. So the first one is postgraduate diploma in digital health, which includes your health informatics in digital health, digital health approaches to evaluation, careers in digital health, strategies on digital health, and then the next one is, as Ms. Rebecca already emphasized, the PGD in data management in public health procurement and supply chain. Next slide, please. Then we have the master's and the postgraduate diploma course in supply chain management, the 24-month program. And students who have already done the PGD in supply chain, they can have that late entry to the MSc of 12 months. And then we have pharma management, which includes pharmaceutical marketing, health supply chain in pharmaceutical industry, medicine policies, pharmacoinformatics, and fundamentals of pharmaceutical manufacturing. Thank you so much. Over to you, Daniel.
Well, thank you very much. And also thank you to all the speakers who have spoken today. I really believe that we got a very holistic and complementary journey and viewpoint on the question. Just to add a little bit more to what Shamli said, I can't stress enough just how impactful these courses have been. I've personally been following their trajectory for the last perhaps 5 years or so. And, seeing the journeys of the graduates, perhaps something to add is that the graduation ceremony takes place in Geneva in the UN headquarters. And just seeing where our graduates end up, including, for example, the Minister of Health of Haiti, so just to say that a lot of the students then end up in very high level roles, either in their ministries or their respective hospitals, their NGOs, UN agencies, and so on and so forth. So I do welcome you to open the links that have been shared in the chat by Shalini, where you can go through the courses that are offered. And if you have any questions, of course, do feel free to ask anyone from Empower or even myself. I'll just share my email in the chat if you have any questions about enrollments or anything else of the sort. So do feel free to reach out. I'll be very happy to provide you with any additional information. So before we move on to the Q&A session, and I see we already have a couple lined up in the Q&A box, but as mentioned, do feel free to also unmute yourselves and ask directly. We'll be concluding with another poll just to get to know your reactions to everything you've heard. So you should be able to see the questions on the screen. So we'll be giving you one. Well, so far we have some pretty encouraging answers. I'll be reading those out and also looking at the reactions of our speakers because I think they deserve to hear just how much the audience has appreciated their inputs. So, and the question, how would you rate your understanding of data-driven decision making after this session? 73% have said significantly improved and 14% have said moderately improved. No change is 0%, so congratulations to all the speakers. In the question, how relevant was the webinar content to your professional role or interests? Highly relevant plus moderately relevant adds up to 90%, with 82% saying highly relevant. Which part of the session did you find most valuable? So here it's all pretty much aligned. Operational decision-making is at 40%. Institutional and academic capacity is at 25%, and skills and career pathways at 30%. Following this webinar, which of the following actions are you most likely to pursue? 45% of you say that you intend to strengthen your skills in data and decision-making, followed by 19% saying that you will apply data-driven approaches to your work. 16%, this is for Rebecca, explore training or certification opportunities, and 14% sharing insights with colleagues or teams. So would you be interested in future learning opportunities? Well, this is very encouraging. 80% of you are saying yes, so that's great. And to the 18% of you who said maybe would like more information, once again, do feel free to reach out to us by email or by clicking on the links in the chat. And overall, how would you rate the quality of speakers and discussions? Between excellent and good, we have 98%, with 76% saying excellent. And would you recommend similar sessions to your colleagues? For stakeholders, 93% saying yes. So thank you very much for that. That's always very encouraging to see. Well, dear participants, you now have the floor to write down your questions in the chat. And of course, you will be receiving a certificate of participation signed by Professor Paul Lobani, the Executive Director of the School of Health, and co-branded by all the stakeholders represented in this webinar. So, dear speakers, with your permission, I'll be reading out some of the questions. Whoever wants to answer, please feel free. None of these questions are addressed to anyone in particular, so just feel free to answer as you see fit. But this first question is from Kiseha Gibrzadik, and it reads as such. How can we improve the higher officials or medical directors or Ministry of Health on the awareness of the supply chain workforce? Mostly, they are not given more attention, especially at the facility level. We all know how much it costs, and when the given health institutions invest more in supply chain, they gain competitive advantage and save a lot. But they, I assume, being senior leadership, ignore it and consider it only a one person's duty. So mostly the decision-making is passive. So I wouldn't say there's a specific question, but lots of observations and perhaps a call for advice. So whoever wants to answer this, do feel free.
I can just chime in quickly. We do have experience advocating with governments and raising awareness around this issue. So it clearly, the people that you're trying to reach with this information have many, many things that they're juggling and many decisions that they're making. So you do have to put this at the forefront, explain some of the challenges that we went over today. But I think presenting evidence, and particularly evidence around potential cost savings, is a real way to get people's attention, especially these days. So any way you can demonstrate how you will save money, how you will reduce the ongoing needs for external support. Training costs are very high, so any way you can demonstrate a reduced need for in-person training, and change to more sustainable, locally led approaches, particularly in the landscape that we're looking at now, where lots of funding is demanding that approaches are more and more country led. I think that's a way that you can get people's attention. Thanks.
Also to add just a quick addition to that, most times we always think that leadership roles are technical roles. Leadership roles are not technical roles per se. So in most instances, your leadership will not have the technical expertise you have, but it is up to you to be able to present your facts to them in a way that makes sense, or to drive them, because what they are looking at basically at that point is, what risk are we exposed to? What cost are we looking at, right? So when you're going to present information to your leadership to get their buy-in into your activity, how you present such information matters. If you carry data, a lot of data to them, it will result to analysis paralysis, and they will not have that time to hear you. But when you start giving them feedback, oh, it costs us to do this. If we don't do this, this is the implication of this. This is the risks. We have 100 people at risk, this, that. That way, we will get them to pay attention to it. And then from there, we can now start engaging them further. Once you get their attention, then you can now start presenting additional details that will also help them, and then get them to be interested in it subsequently.
Thank you, Philip. I also just want to add that when it comes to leadership roles, it's not one person's sole, responsibility or duty. But yes, we really have to emphasize that, using simple evidence in terms of delay treatment or stock out expiries, and using quick wins from few facilities example, just to emphasize that yes, investing in a supply chain actually saves money, like as Rebecca emphasized on, like how we can emphasize on the financial aspect and on the clinical aspect, because when we have to push for some accountability and recognition, and also include, you can say, some you can say short and core evidences in terms of examples to make them aware, like as Philip mentioned, that they at many levels, they don't have that technical aspect or technical knowledge, but and giving them understanding in terms of different examples, live examples, quick wins from different facility examples can definitely, bring a lot of change in their understanding. Thank you.
Thank you very much to all three of you. I think your answers were just as complimentary as your presentation, so that's really nice. I don't see any other questions on the subject matter, but I do see a question about the master's program that was mentioned by Shamli. It's from Tirani Waterman. If you complete the postgraduate diploma in data management in public health procurement and supply chain, can you continue into the 12-month master's in global health procurement and supply chain? Shamli, perhaps you could answer that, or anyone else from the power.
So if you complete the postgraduate diploma in data management, okay, sorry, Kiran, this is not a stackable program, but if you have your PGD in supply chain, in global health procurement and supply chain, then you can continue in the 12 months masters in the same domain. But if you are talking about data management, no, then you cannot have that later entry that I mentioned. Thank you.
Well, I think this has covered all the questions from the participants. We do look forward to welcoming you next month. We do these webinars every single last Thursday of the month. So we hope to see you again. And I'll be, of course, seeing Shamli and Shalini and Harpreet as we do every last Thursday. But allow me to also express my appreciation to Philip and to Rebecca. It was a pleasure meeting you and to hearing your insights. And we hope to work with you again in the very near future. Wishing you all a very pleasant day, and also hoping to welcoming you to our joint programs very soon.
Thank you. Thank you so much, Daniel. Thank you, Rebecca. Thank you, Mr. Philip. Thank you, all the attendees.